that changes the health of their child, potentially for the rest of its life. The book is called Origins. It's a book every teenage girl should read. And sometimes it's not the mother, it's the grandmother or the grandfather. And it's even been traced to great-grandparents, because these can be passed down generation after generation. Dr. David Williams, Director of Research, Linus Pauling Institute. Notice the mouse on his shoulder. It's a happy mouse. It carries an oncogene, a gene that causes cancer. Its mother was fed phytonutrients during the pregnancy. The gene has been turned off. The mother will never develop that, the child, baby mouse, will never develop that cancer. One day, pregnant women will be prescribed a dietary supplement that will protect her future children from cancer. It's not science fiction, it's where we're headed. Well, guess what? It's not a dietary supplement, it's not a prescription. It's been available for 22 years. And we have seen a lot of healthy babies. Yes. All of these diseases have epigenetic switches that can be determined before the baby has an opportunity to make a choice for itself. And look at those diseases. We have an epidemic of those diseases right now. It's been increasing ever since World War II. World War II, we had 16 million men at war. We couldn't grow enough food to feed America. Food was rationed. Joe and I remember victory gardens. We were asked to grow gardens so we'd have enough food to feed the family. And I lived in Buffalo, so we had to can the food so we could eat in the winter. We didn't have freezers back then. And then from a nation of rationed food, we became a nation of abundance. And fast food that was a result of our abundance. And then junk food. And now we have stuff they call food that's sold in the markets that has negative nutritional value, does more harm than good in the human body. But we've got an opportunity to change that, because we know with 2 decades of research, it's bad food and stress that support the bad genes and suppress the good genes. And we can change all of that, because we know more than anything else, it's phytonutrients from whole food, plant-based nutrition that promotes the good genes and suppresses the bad genes, working on the epigenome. An opportunity to make a huge difference in this world. Okay, let's shift gears. Cardiovascular disease. What are the aspects of physiology that lead to cardiovascular disease? Well, oxidative stress, particularly to the blood vessels. Inflammation, the chronic silent inflammation. Cholesterol metabolism, particularly the oxidized LDL. You see, you eat lipid, it goes to your liver, and you make LDL, that's the bad cholesterol. It carries the cholesterol to your cells. Your cells take that cholesterol and metabolize it into cell membranes and into good things, hormones, things you need to live. And then a scavenger molecule comes by and picks up the leftover cholesterol and takes it back to the liver. And you excrete it as bile. When it goes back to the liver, it's no longer LDL, it's HDL, the good cholesterol. So if your HDL is too low, which is a marker for coronary disease, it's because you've oxidized your LDL and you're leaving it in the tissues because it's rancid and the scavenger molecule can't recognize it, can't carry it back. And then you've got homocysteine, an independent marker of your probability of death from any cause. It's an amino acid that you can't live without, but you have to keep it under control. You have to keep it below a certain level. And then spasm of the blood vessels. If your vessel's 40% occluded and you have spasm and you're trying to do something like exercise, that spasm is enough to occlude it totally. 25 separate studies peer-reviewed studies impacting that physiology.
Wow.
Okay, immune system. We all know it's important. All of these 4 studies were in subjects who were under terrible stress. 500 nurses in the largest hospital of Europe for 7 months during a cold winter. Elite athletes, these are the anti-terrorism force of Austria. First-year law students, University of Florida. Elderly people in general have weak immune systems. All 4 studies, they were under stress because of their activities, and their immune systems were suppressed. Juice Plus brought their immune systems back up, and the placebo groups had deterioration and no improvement of their immune systems. We all love our Juice Plus glow, our appearance of health and youth. The German scientists took it seriously. 4-month study. Every one of these women had improvement of these markers of skin health and beauty. Fewer lines and wrinkles. Everyone said, thank you very much. And the placebo group said, I want what they were taking. Okay, smokers have trouble with their lungs. We all know that. Juice Plus was studied in these men who had a history of 20-pack years of smoking or more. Juice Plus improved parameters of lung function even in those men who continued to smoke. Don't smoke. I don't care how much Juice Plus you take, never smoke. Periodontal disease. Think how serious this is. There are many countries that don't have enough water, let alone toothbrushes. Periodontal is a universal problem around the world. It's deep infection around the teeth, and it's bad. It's an infection, and it's inflammatory, and it releases bad things into your system, and where it lands, it causes trouble. More stroke, more cancer, more heart attacks, more just about everything.